Great.
Good.
Hi, Dr. Brixius. Thank you for joining us in Big Spoon Little Spoon's Faces of Autism initiative. So Faces of Autism aims to elevate the voices of autistic individuals, as well as community volunteers, leaders, researchers, and health experts. So Dr. Brixius earned her diploma in molecular biology and a PhD in biochemistry at Saarland University in Germany. She is an assistant professor at the University of Pittsburgh in the School of Pharmacy. Dr. Brixius is a passionate biochemist and structural biologist who considers science as a lifestyle rather than just a job. Her research focuses on targeting cytochrome P450 enzymes for the treatment of human disease, with a special focus on fatty acid metabolism. She is a passionate advocate for diversity in science and enjoys mentoring the next generation of scientists. So today we've invited her to share her lived experience of autism, how it influenced her work in academia, and her experience as a parent of a child on the autism spectrum. So let's get started with our interview. So our first question for you, Dr. Brixius, is how has your lived experience of autism in the field of academia influenced your work as a scientist and researcher?
So first of all, thank you for having me. I'm really excited. I think that's a great initiative. So that's a hard question to answer because I was for 41 years not aware that I'm on the autism spectrum. So I can always see it in retrospective, right? I think, and I also can only talk about my autistic experience, which is different in every individual, right? So I think for science, what people always want to have is this outside of the box thinking. And I think that neurodivergent people and autistic people are bringing that to the table. I think it's really how our brain is wired, that we approach things differently. And for the scientific approach, that is often a game changer because you need outside of the box thinking and not doing it like the last 50 years people have done it. Another thing really is, and that is true for me, many autistic people have a very great ability to hyper focus on things. They're very detail oriented, and that is very true for me. I get lost in science. So when I am reading something or I'm writing something, I get lost. I can do that for hours. I ignore my husband, my children, my dogs. It's just really hard to get out of that. But that is actually what is a really great trait for a scientist, actually. It's also about pattern recognition, how to compare scientific outcomes from different experiments. You can compare them because you see directly what is different and little tiny things which sometimes make a difference. I think that is, I will attribute that to my autism, actually. Apart from the scientific part, I think it makes me a better mentor. The things I was going through with my daughter, and we talk about this later, I know, but it makes me really more compassionate. I know how hard it is for people who are just different than your usual academic person, which means neurodivergent people of color, LGBTQ community. It is very, very difficult to actually be different in academia. And I think that makes me a better mentor because I think I'm more oriented on the individual rather than having the stereotype in front of me. I think that makes a difference.
Mm-hmm. Thank you, Dr. Brixius.
Sure.
Yes. Our next question for you is, how has your experience as a parent of an autistic child impacted you, which relates to what you were discussing with us earlier?
Yeah, it has two sides of the story, actually. One of them is my daughter is just so different in a way how she's thinking, and she has been like this since she was a baby, actually. She was always different. And it's listening to her and what conclusion she draws and how she sees the world is just so so great. It's just very different, and I have a lot of fun with that. And it's just great. And we are very much alike, so I can empathize a lot with her, because she's kind of a little bit like my mini me, I would say. But I also saw, when she was first diagnosed, what kind of disbelief and ignorance she had to face. So she was diagnosed when she was 13, and she struggled in school, and it was not that she's not, that's what I'm also talking about later, that she's not smart. School just caused a lot of anxiety in her. Bright lights, no accommodations, and the school was not very willing to give us accommodations without a autism assessment. And that made me like really angry. I got really angry multiple times, because, oh my gosh, she doesn't seem autistic. Why would she need accommodations? She seems smart. It was like, it doesn't have anything to do with her intelligence. She's overwhelmed. But yeah. And first of all, and most of all, without my daughter, I would not have been diagnosed at all. Because through my daughter and visiting her therapist with her, it hit me that, oh, okay, these are the same things I struggle with. That's interesting. Maybe I should get tested. And yeah, here we are. So yeah, it was actually an eye-opener.
For sure. Absolutely. And as an autistic individual, researcher, and advocate, as well as a parent of an autistic child, what do you think needs to be better understood about autism?
Oh, there are so many things. So many things. First of all, autistic people are not dumb. They are not dumb. Only because they are overwhelmed from time to time. They have these meltdowns. They might be nonverbal. This has nothing to do with their brain capacity. So when I read something like, oh, they have a lower IQ, it's like, really? Oh my gosh, only because we are actually, neurotypical people are too, like, they didn't find ways yet to communicate with nonverbal autistic people. Doesn't mean they are dumb. So that is what freaks me out. There is this environmental activist, Greta Thunberg. I don't know how, she's very famous, and she is on the spectrum, and people think she is too dumb to actually do, so her parents must micromanage her. It's like, she's really smart. What is going on? So autistic people are not dumb. Really not. We are just very different. Our brains are wired differently. And that is also associated with, we are also not pretenders. When we say something smells too strong for us, the lights are bright, it's too noisy, and it's not pretense, it's real. It hurts sometimes. And that is what people have to understand, that this can really hurt, physically hurt, when it's too overwhelming. Same with eye contact. We're not unpolite. We want to be polite, sure, but eye contact sometimes hurts, especially when we are not well rested and already exhausted. So this also leads me to masking. I wish people understood that what people, like I said, with my daughter, teacher said, she doesn't seem autistic. She's smiling. She's so polite. It's like, yeah, she trained that so that she doesn't stand out. That's called masking. And every autistic person does that, because if they unmask, they are very afraid that they might be seen in a different light, not taken seriously anymore, or, acting crazy or something like that. So what you see is very often not the true color. It's what we learned by studying neurotypical people, how they behave. And we mimic very often, and I did that as a child, mimic their behavior. That's as easy as it gets. Also, last thing, I could go on for hours about this, but what I'm really mad about is like, oh, today everybody is autistic. The overdiagnosis, where it's like, there is no overdiagnosis. There was an underdiagnosis for not centuries, but decades. especially for girls, because people thought girls are not autistic. It's a boys thing, right? So what we see now in the emerging numbers of autistic people is they finally get diagnosed and get the accommodations because science progressed and psychology progressed on that. So there is no overdiagnosis. There's a really strict guideline what qualifies as autism, and that is followed. Yep.
Thank you, Dr. Brixius. And finally, what supports do you think neurodivergent people in academia or neurodivergent individuals in general should have or have more of?
First of all, no gaslighting anymore. Like, I don't know. I come from a generation, I grew up in the 80s in Germany, and you had to suck it up. If you had a problem, you had to suck it up, which means don't make drama at all. So what I hear sometimes is when students ask for accommodation, is like, well, in the future you have to you really have to face real life. You cannot go on like this. Things like that. And it makes me mad because they are not pretenders. They really need the accommodations. And it's not much they ask for. So let alone this, like, you don't seem autistic. I disclose my autism very, like, always, and I often get like, but you're very social, you're funny. It's like, yeah, I can be. It doesn't mean that I'm not autistic. So the gaslighting should stop. If people disclose with you that that people are autistic, you should believe them and accommodate that, and not try to convince them that they are not autistic, because they are. What you see is the masking, and that makes you think they are not. So faculty and educators should acknowledge that people are autistic without, telling them they are not. The accommodations, it doesn't need much accommodation to make autistic people thrive. My daughter didn't get any accommodations first, and it was horrible. It was a horrible experience. We changed schools when I started in Pittsburgh as a faculty member, and all of a sudden she got accommodations, just little ones, a little bit more time in testing, a little bit, like breakouts, like where she could just leave the classroom and be with the nurse just to decompress. And that boosted her grades. All of a sudden, her grades were great. So it doesn't need much. You just have to provide it. I think we also have to do better in not trying to turn them into neurotypical people, let's say on conferences. We have to give them breaks. We have to acknowledge that they learn in a different way than we do. Conferences, closed captions should be normal, because very often autistic people cannot follow spoken words. There's so many things we can do, but the first of all is just to accept and acknowledge that we are different would be already really great. Yep.
Thank you, Dr. Brixius, for sharing with us your insights and expertise today. On behalf of Big Spoon Little Spoon, we are so thankful for the opportunity to interview you today. Thank you, and we'll see you next time.
My pleasure. Thank you so much.